So today we are going to talk about weight management because it's Valentine's Day and Valentine's Day is coming up, and a lot of people have so many concerns about their weight and how they're going to look, and you're going out and you want to do things, so you want to look good, right? So let me introduce myself again. I'm Dr. Luella Ayoka, and this is a um, medical consultation talk. Medical consultation talk. Okay, so what I'm doing is I'm helping people with their medical journey and answering questions and trying to answer questions to help people understand anything about the medical field, like your conditions, maybe your prescriptions, um, maybe you just have a question about physicians or anything. So I'm here to help you, and I'm glad that I can be able to do these talks. I'm glad that I can actually give you some insight and some more understanding about your medical journey. I call it the medical journey, and I was going to say the medical field, but I call it the medical journey. So so I'm doing these health talks, and it's so good to be here once again. And I decided to talk about weight control because, again, when I think about Valentine's Day, I think about how it's a day of love. It's a day of relationship and bonding, and people get caught up in how they look, because more so I'm thinking about, of course, you're going out on a date. So, of course, you get your hair done. For men, you get your hair cut, you dress up, and then you have dinner plans, and you're in the mirror like, should I wear red? Should I wear green? All of that. And so I thought weight control would be a good topic to discuss. And so let's see. So when I was thinking about it, one of the things people ask all the time is that, one, they say, okay, should I inject? So you have, now, let me go back. We're in a weight loss revolution. Okay. And everybody now is really focused on their bodies. And of course, we get one body. When I was thinking about this, I was thinking about we get one body, right? One life, one body. I'm telling you, if we could have two or three bodies, that would be so awesome, because then we can make changes when we need to and do something quick, right? And change things really, really fast. But that doesn't happen. And so, unfortunately, we get one, and we get one chance during this lifetime for however many years you live. So, what do we do to take care of that body, right? And one of the things is it evolved. I'm sure it's been because when we look back in history, and I look back in history, and we look back at the hands of time, our appearance means a lot. You know, what constitutes as pretty versus what constitutes as handsome versus what constitutes as healthy looking versus what constitutes as non-healthy looking. Okay. And so there are now, we have, of course, models, and we have pictures and depictions of what a normal body is supposed to look like. And so we get this mindset in our mind that, okay, I have to look like that. Now, everybody comes in different size, shapes, colors, ideas, character, whatever you want to call it. Everybody comes in those different forms and shapes, right? We know that. And so everybody may not have or are not going to have the same physique. I say that, and we all heard this growing up, right? I know we did. If we all look the same, talk the same, walk the same, this will be a boring world. So now it seems like I know I haven't been on this earth very long because, I'm young. Don't let the gray hair fool you. But I've been on this earth for a lengthy amount of time. And in my time, I've noticed a shift in weight management. And in my past, maybe in your past, but in my past, it was it wasn't it was a big deal. People cared about it, But now it seems like it's becoming more and more and more important. Of course, us as physicians, we want you to have the best outcome, the best health, the best look you can have. That is our goal for you, just as much as it is for you having a goal for you, if you desire that. And now some people don't. Some people are okay with how they look. They're okay with their weight. They're okay with maybe a little bit of extra on the side, extra around the top, extra around the bottom, but everybody isn't. So I get patients all the time in every size, shape, that are concerned about their weight, contrary to popular belief. I get people that are skinny that will say, or thin, on a thin stature side, will say, Doc, I am too thin. And then I get people on a heavier side that say, Doc, I'm too heavy. And then I get people that are in between, that's not even too thin or too heavy, that say, I just don't like the way I look. I need to lose weight or I need to gain weight. I find that very interesting. There are two extremes. And it's like, what's the middleman? What's the middleman? It's kind of hard to tell because everybody is different. Everybody has a different mindset. Everybody has a different thought process. And it's not one size fits all. Okay. I wanted you to drive that home with you. Weight management and weight control is not a one size fits all. It is what you want of it. It is what you make of it. And there are different variations of how that can come about. And one of the things that I have found in my experience is that what works for one doesn't work for others. And so, therefore, what we try to do, we try to come up with what we call the comprehensive plan. And the comprehensive plan can include many different factors. You may start out with one, and that one could start working. Now, there is a thing in weight control, as we all know, it's called a plateau. What do you do when you hit the plateau and what you're doing now? So then we try to find different other ways so that you don't hit that plateau. Or, I'm sorry, you can overcome that plateau. And so, therefore, which is nice because one of the things you don't want to do is, and this is in general in medicine, you don't want to start out too fast. Okay. So when you're coming up with your weight plan with your physician, you don't want to get a whole lot of stuff like, Doc, I'm coming in and I want to lose, weight quick. And well, some people do and some people need to. And there are ways you can do that. There are plenty of ways where you can lose weight fast. I tell you one thing I've seen people do. And is it healthy? Well, that depends. Um, you can get good control, but in the end, it may come back and it may come back as fast as you lost it. It'll come back as fast as you gain it. So, one of the things I see people do, what do we all do? Give up their carbs. So, you stop eating the rice, the pasta, you stop eating candy, cookies, ice cream, and cakes, and you just eliminate that from your diet altogether. Breads, some people say I eliminated white bread, but they do breads altogether. So now you're getting just protein like meats and vegetables and fruit, and you know and that's pretty much how you eat every day. And you can lose weight with that. You can lose weight, you can lose your physique very fast. And I've seen it. I've seen a lot of people do that. A lot of times people do that in these weight loss challenges. They'll go on a weight loss challenge and they'll stop their carbs and they'll lose quite a bit of pounds. So they'll lose like 20 pounds. You see them one day and they're like really, really heavier on the heavier side. You see them the next day and they're slim and you say, well, what did you do? And they say, well, I didn't eat the carbs. Is that a healthier option? In certain instances, it can be, especially if you have a condition that carbs are not good for you. Maybe you do have a condition and it's not necessarily diabetes, but there are conditions that have a problem with metabolizing, or we call it metabolizing, excuse me, breaking down carbohydrates. And so they are not really, it's not good for that particular person. And of course, you can talk to your primary care physician to find out if you even have that. You can test for that to see if there is a problem with carbohydrate, breaking them down to make them better so that your body can utilize them better. So that's one of the ways that people lose weight fast. Now, there are other ways that people lose weight fast, and I'm not going to get into that all today because for the sake of time, and I don't want to keep you too long because I know you got to get out there and finish getting yourself ready and preparing, figuring out where you're going to go on your date on Saturday and figure out what you're going to do for the weekend for those that spend the whole weekend and whatever else the case. So, I wanted to make you aware of that. No size fits all. Okay. Weight management and weight control is not one size fits all. It's what works for you. And one of the things I want you to realize is that you have to learn how to love yourself. You have to learn how to love your body. Weight management actually starts with you loving yourself. Weight management starts with you loving your body, accepting how you were made. You may not ever look like me. Okay. If you consider me fat, then you may not ever be fat. And if you consider me skinny, you may not ever be skinny. That is truly a possibility based on the composition of your body, because again, you get one body. Now, there are plenty of people, and people can say this that, yes, I can look like you. Okay. But I want you to understand that you got to first accept yourself. And one of the things that I tell my patients is that you got to accept yourself first. The second thing I want you to do is have accountability. Have somebody that's accountable, that you're accountable to. We can't do this on our own. Weight management and weight control, and anybody that has lost weight, anyone that has been on this journey or even worked to gain weight do not do it on their own. And if they did have some type of person, somebody that they can bounce it off with, that they can talk to, even if you journal, even if it's you, okay? Just don't do it on your own. One of the things I find is that when people come together and they do things together, they get better results. So, for instance, what you can do, you can go to your physician. You can talk to them about your weight. You can actually do a visit for weight. You don't necessarily have to go to a separate weight loss clinic or someplace else. Now, those places are good, and I don't want to take anything away from them because they are good. There are some very reputable weight management programs and weight control programs. But if you just want to do something simple, you already have a physician. Talk to your physician and let them know your concerns. And when you do let them know your concerns, then if they give you a little snippet of something, you can let me know. And we can talk more about what are your other options because there are so many other options for you. If they don't and they do take that into consideration, maybe their little snippet is what they want you to start with. And then what you do is you go back and you talk again and have another conversation about what worked for you. Think about that. That's a good idea. That's a good plan. So, again, this weight management, weight control is not one size fits all. So, if you're wondering, should I inject? Should I take a pill? Should I exercise? Should I do portion control? And the myriad of other things that we use to lose weight, that is a conversation that you want to have with your primary. That is a conversation that you want to come up with because you want to come up with a comprehensive plan. Okay? So start out by first loving yourself. How do you love yourself? You look in the mirror, you tell yourself you look good. You look good. I'm telling you, you look good. I'm letting you know I don't see you, but I'm sure if I saw you, I would tell you, you look good. You look great. You may not feel all that great, but you look great. So the more you tell yourself, I look great, the more you'll start to feel I look great. Okay. And so that's a part of loving yourself. Because if no one else, and if you can do this on your own, because those that have done it on their own, you can look in the mirror, because you look in the mirror every day. You see you every day. I don't see you every day. Other people don't see you every day, but you see you every day. And you can say, you look great. What's the harm in that? How much does it cost you to tell yourself you look great? I just thought about that. How much does it cost you to tell yourself you look great? Nothing. And it's so easy. It's 3 words. You look great. 3 words every day. Out of the many words we say, the many things we think, you can say those 3 words in a mirror. Nobody has to know. And it does wonders for you loving yourself. It does wonders for you at least starting that weight management program or that weight control program. You look great. And when you start to say you look great, then you start to think, and it is so interesting because I'm going to tell you something. I know I knew a person that, they did not think of themselves very highly. Okay. They did not think that they were good enough for anyone. And I remember having a conversation with them about telling themselves, you look good, or letting them tell them to, you know, start saying positive things about yourself, basically. All right. Sounds really stupid and simple. But one of the things I found when I started doing that and letting them know, and it wasn't letting them know, then I found that it motivated them more. They started to walk more. They started to want to exercise. They started looking into things that they're supposed to eat and what can help them without gaining the calories so much. And then they went on to do more and more. And I watched how their whole attitude changed, because as they did lose the weight that they had on them, they felt better, they looked better, they sounded better. They became just a different person with a different personality, because that happens. And then vice versa, I've seen the same with a person that was too thin, or they felt though as though they were too thin. When you are too thin, you do there is a let me just go and tell you this much, and then that's it, you guys. So, the people that are too thin, there can be an unhealthy weight of being too thin. We call it underweight. And just like there is a unhealthy weight and unhealthy weight being too obese, and that's called morbid obesity. Okay, so those are the two extremes of weight. It's either underweight or morbid obesity, and both conditions are unhealthy. When you're underweight, you aren't able to produce the appropriate amount of nutrients that's needed to maintain life. So that's why you hear people die of starvation. Okay, because you need macronutrients, micronutrients in order to survive. So people can't survive for a certain amount of days. And as you watch them, they become underweight. So that is true. Most times people can't starve themselves, because again, it's just like the thermal regulation. You have that innate ability to tell you to do what you need to do. Now, some people it is compromised, but for most people, you will listen to yourself. Just like when you say you look great, you will listen to yourself, because you have that innate system to listen to yourself. You are your greatest advocate. You are your greatest friend. You are. And that's why you're so beautiful. And that's why you're so handsome. And that's what makes you who you are. And that's what makes you so unique. And so then, if you're morbid obese, meaning morbid, high morbid obesity, you aren't able to utilize the nutrients either. They kind of get stuck. And not only that, you compromise the functions of the body that are necessary. And so, therefore, you are more apt to have something that can cause that can cause death. Not only, of course, it can compromise the blood flow because you have too much of that particular mass inside of you. It's too much. And anything that's too much will actually hurt you. So you may not get the proper blood flow to your brain. You may not get the proper blood flow to your heart. You may not get the proper blood flow to your legs. And then a lot of times you're carrying so much. Just think about lifting a big, 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 heavy box. How far can you walk with that without being tired? How far can you move without being tired? So, in those instances, there are doctors and there are places where you can go that will definitely help you to manage that well. I just wanted to give you that tidbit. So, I hope this helped. I hope you get out there. I hope you get in front of your mirror starting tonight and say, "You look great," because you do. This is My Medical Moments Health Talk for Happy Valentine's Day. I hope you get out there and have a wonderful time and be safe. If you get a chance, go check out the Super Bowl talk. That was pretty good. Go check out some of the other vignettes that I have posted about all kinds of different topics. I'm going to start piggybacking off of some of them and start continuing on. And you probably see me tomorrow just for a little 2 minute, 1 minute of your time so that you can hear from me because I love spending time with you. My name is Dr. Luella Ayoka, My Medical Moments, and please subscribe to my YouTube channel. Good night.